Get ready. Get ready. Hello and welcome to Seven Sentinels. This is Grand Master Class and I'm Peter Simon with you. These programs are a part and parcel of classical corrections from the Seven Sentinels group. Today we are going to do part B, reading. Part B, complete set, 6 questions. Here we go. Your time starts now. Yes. So there we go. Now question number. Yes. So, right. Right, charts. Question 1. Reading. Reading. Question 1. Yes, question 1. 7, 6, 5, 4, 3, 2, 1. Submit. Desi, Meera, Ushani. Very good. These are the regular students. What about the others? Next. Question number 2. 7, 6, 5, 4, 3, 2, 1. Submit. Desi, Meera, Ushani, Joseph. Right. Question number 3. 7, 6, 5, 4, 3, 2, 1. Submit. Question number 4. 7, 6, 5, 4, 3, 2, 1, and submit. Joseph, Meera, Ushani, and Desi. Good. Question number 5. 7, 6, 5, 4, 3, 2, 1, and submit. Joseph, Ushani, Meera, and Desi. Question number 6. 7, 6, 5, 4, 3, 2, 1, and submit. Wow. Joseph, Ushani, Meera, and Desi. So you're learning how to do. Very good. Suddenly they came out answers at a time. That's really great. Yeah. So we have got the answers. Now let us check the answers. Let us check the answers. Reading test 1. Yes, question number 1. Part B. Question number 1 is B. Take your answers in your notebook. Question number 1 is B. Then question number 2 is C. Question number 2 is a C. Question number 3 is A. Question number 3 is A. Question number 4 is B. Question number 4 is B. Question number 5, A. Question number 6 is B. Question number 6 is B. Yes, that's it. B, C, A, B, A, B. So, we got the questions, answers. Now scores. Type and keep it ready. Yeah. So 7, 6, 5, 4, 3, 2, 1, and submit. Desi 4/6, Mira 6/6. Ushani 3/6, sorry. Joseph Palraj 3. Right. So now, that's very good. We have had a practice. That's good, really good. Now the next question. Question number 7 or question number. Okay, question. The big question is, okay, question number 1. Okay, how was the experience? Reading experience. Reading experience, part B. Write your words. Okay. Share your experience. So we'll be doing like this one, and afterwards we'll be discussing the answers. Yeah, you can share. How was the reading experience? So I gave a little more time because sometimes, some questions you need more time, some need less time. But 2 minutes per question, you have to limit as far as possible. So we are fixing one reading and one listening, part B and part B. One. Okay. Yeah. So shall we have one session like this on a daily basis? Slowly we'll introduce part C also from tomorrow. So every day 6 questions. That will be awesome. We have already discussed the timing yesterday, but this test is different. So this may be intermediate. So what were the timings? Neetu Sajikumar. Neetu is not there. Meera Manoj and Neetu. So, okay, you can message the timing. What was the timing yesterday? We had here, let me check. Timings. Somebody write the timings. So 1 hour listening and 1 hour reading. Regular students, all the regular students who have registered. Okay. So anybody remembers the time, just message that. Let me check. Yesterday. Yeah. So these are strictly for registered students. So 6 p.m. listening lecture will be there. 6 p.m. listening lecture will be there. And then 8 p.m. reading lecture will be there. So after reading lecture, we'll have this. Okay, these are my lectures. 6 o'clock, I will teach. That is different. Okay, then 8 o'clock, we have reading. So in between 9 and 10, after this reading is finished, so first we'll start with listening. Okay, then we'll go for reading. Then this test will be there, practice for part B. Okay, part B, reading. Part A, I don't think the problem is there for many people. So part B and part C. So first we'll finish with listening part B, then listening part C. Straight like this only. I'll put all the slides in front of you. You have to practice. So then immediately after this, reading part B and part C we'll do. So we'll take the timing for each question. We'll do that one. So all the registered regular students, yeah. 6 to 7 is listening, 8 to 9 is reading, writing is 11 to 12. But in between, after reading, we'll take this. We'll finish off with reading and listening. Practice. Then afterwards, we'll go for writing. Yeah. So we shall meet all the regular students who have registered. Will meet tomorrow according to the scheduled timings. Okay. So now I'm going to give you a brief explanation regarding what we have done. Okay. Yeah. Yes. Now this is reading. This is listening. Right. Now see here, there are some shortcuts which I am going to explain you. First, I will not take too much of your time. Okay. I will not take too much of your time. Okay. Yeah. So blue. Okay. Right. You hear a nurse briefing her colleague about a patient. You hear. You are hearing, but you are not actually hearing, you are listening. Remember that. Listen with concentration. So who is speaking? A nurse. What is she doing? She is briefing. Briefing means telling some history in short. Whom? Her colleague, another nurse. About whom? A patient, one patient. So this is the background story. Okay, what does a she? She is warning. Who is warning? The nurse is warning. Her colleague. So this briefing is not a briefing, but it is indirectly, ultimately it's a warning. About what? About what? About something. So what is that something? That something is allergy. Problem. That something should be a problem because this is a warning. Warning about something. This is a problem. What is that? That is a problem. That problem may be allergy. Okay, that so in this you can see, so that may be an allergy. Okay, that may be an allergy. Or in this sentence, allergy is the problem. Antibiotics is not a problem. The patient is not a problem. Types are not problem. Antibiotics are not problem. Allergy is the problem. So warning about a problem. That's it. Warning about what? About a problem. Warning you will give only regarding some problems. So this what is a problem. And in this sentence, it is allergy. Care must be taken. Care is a positive one. Taken, positive, prevent. Prevent is positive. Prevention is positive. Patient is positive, but falling is negative. So this fellow falls down. This patient falls down here and there. So falling is a negative problem. Falling is a problem. Then oxygen is positive, needed is positive, patient is positive, becomes is positive, but breathless is negative. So he may be warning about, so simple as that. You have to think, is she warning about, okay? Is she warning about so she is warning about something. Warning about something, that something is allergy, or that something is falling, or that something is breathlessness. So these are the three words only important. These are very, very important. What are the other things not important? So warning about breathlessness. If she is breathless, oxygen should be given. If she is able to, she is going to fall, so you have to prevent. Okay. She is allergic to some sort of antibiotics. So allergy is the problem, or falling is the problem, or breathless is a problem. So that's very clear now. That's very clear. So you have to focus on these three things. He will tell about allergy. He will tell about falling. He will also tell about breathless. Everything will be told. You have to see positive and negative, positive and negative, positive and negative. Okay. Right. So this is the point. Print screen. So I'll give you explanations like this. So this is question number 1. Explanation for question number 1. Now, I want your point. Okay, listening. Okay, listening B. Listening B. 01. Okay, listening B01 was the explanation useful. If say it is useful, then I'll go for the next one. If it says it's not useful, then we can stop here because the explanation is not useful. So if you want, if you are interested in such explanation, you give me points. Okay. So is the explanation useful, or if you have any doubts, next question is any doubts. If the explanation was not useful, you have some doubts. Those doubts you have to explain. Come on, fast. Just 5 seconds or maximum 10 seconds. Okay. So this is not useful then. Okay, 2 points. Okay, because two students have said it's useful, so I'm going to give you another explanation. Only two explanations I'll give. Okay, sorry. So next one. So here, second question. Now in the second question, what we are going to do? Okay. Right. Now here, you hear the manager. So the manager is talking. And this manager of a care home. And the setting is care home. And in this, the elderly people, aged people, senior citizens will be there. And talking to the nursing staff. So all the staff are there. Maybe one member or many, all the members. The nursing staff. Not a nursing staff, it's the nursing staff. All there together. So nursing staff. He says that errors means problems again. Errors means problems. Errors in dispensing medication to patients usually result from. Result means effect. Errors are the effect. So what is the cause? These errors are the results. Cause and effect. So this is the consequence. Errors, problems are there. Because of what? A result from what? Because of what? Due to what? Because of what? So, medication, interruptions. 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 Try to understand that. Interruptions. Interruptions is a problem. You're talking, in between somebody come and interrupt. That is a nonsense. It's a problem. For example, I am teaching. Somebody comes and tells something. Suppose a guest will come. It's an interruption. My teaching goes to the garbage. So, what happens? A neighbor comes and interrupts me while I'm teaching. Then what happens? There will be a problem. Okay, I cannot teach properly because they are there like that. Okay, a failure to check for patients' allergies. So allergies are the problems, and a failure to check. Do not check, not check. Failure to check, not check. And okay, this is talking about dosages. This is talking about allergies. Try to understand here. Try to understand here. And this is administering drugs. This is drugs. And this is late in the day. Late in the day. Late in the day means evening. Late in the day means evening. Not morning and afternoon. It's evening. Not morning and afternoon. It is evening. Okay. Right. So, now try to understand here. So there are two things. Early is not a problem. Late is a problem. Coming late to the class is a problem. Interruptions is a problem. A failure to check, negligence is a problem. This is negligence, is a problem. Try to understand that. Negligence is a problem. Fine. Negligence is a problem. So now see here. Here he is talking about dosages. Dosage means how much. Here is talking about allergies. And here is talking about drugs. See the difference. Dosages, problem related to dosages, how much to measure. This is measurement. When you are measuring, somebody comes and you disturb. You are disturbed. So problem. Allergies are there. Allergies are there, already a problem. And if you do not check, it's a bigger problem. Okay, how much should give dosage? You are measuring. If you don't measure properly, that's a problem. And somebody comes in between and disturbs, that's still a bigger problem. Okay. And drugs. You are giving drugs. Okay. You are giving drugs because there is a problem. And giving drugs late in the day. Okay. So, now try to understand here. Is it talking about dosages, problems related to dosage, calculating the amounts? Okay, measuring the amount. For example, 200 ml. And somebody is coming in between and you pour 250 ml or 150 ml. Then what is the thing? Okay. Next one, allergies are there. You don't check. Drugs are given. Okay. When problems will be more. Late means evening. Morning or afternoon or evening. Late means evening. PM. Early means AM. Okay. So like that. Morning or afternoon or evening. These timings may come. So you can guess from here. So this is how errors may be because of interruptions. Errors may be because of interruptions. Errors if somebody interrupt. Errors will be there if you do not check. Errors will be there if you give late. Okay. So this is how you can find out. So this is the clue for you. These are the clues for you. Errors. All the questions will be in the negative form only. Questions means problems. Question means problem. Question means problem. Remember that. The words may differ. The words may differ. In the previous one, some other thing was there. And in this question, errors is there. The word errors is there. Okay. So this is the way how we are going to guess. So focus on somebody is coming and interrupting, you make a problem. Or if you do not check properly, there is a problem. Okay. Or drugs giving in the evening is a problem. Is a problem. All right. I'm posting these hints in the Telegram channel. So previous one was what? Previous one was warning. Warning means problem. Warning means problem. Warning means problem. See here. Previous question, warning was the problem. Okay. Previous question, warning was the problem. And this question, errors is the problem. Errors means problem here. Errors. Question is a problem. Problem means errors. Question is a problem. Warning means problem. Question is a problem. The word related to problem is warning. Question is a problem. The word related to problem is error. That's it. What is a question? First, do you know what is a question? Question means a problem. If you don't understand that one, how will you go to the end result? So this is how I have given here. Afterwards, you can go through them leisurely. Next point. Point number 3. Question number 27. So, Before that one question. So nobody will tell it was useful or useless. Nobody, no worry. I will do my job because there will be many people who will be watching these things in the future. Okay. Today I'm giving a free session, so this will be in the YouTube, but tomorrow it will not be there. Those who are missing the class will miss it. Okay. Question number 27. Now here see, right? Question number 23. Right. Now, how are we going to deal with this question? Right. Now, let us see here. You hear a part of the morning briefing on a hospital ward. It is a hospital ward. There is a morning briefing, means superior, the boss or the manager or the in-charge nurse or the doctor will be giving a briefing. Briefing means short information, brief information related to the activity which we are going to gist, summary, not everything, summary. Briefing means summary. So this is a briefing. So what is the plan for the patient today? Patient is a problem. Is a patient because he has some problem. And this plan is to solve the problem. This is the solution for this problem. Plan is a solution for this problem. Patient has some disease, some sickness, some difficulty. Patient itself is a problem. So plan is a solution for that problem. Okay. Plan is a solution for that problem. If that solution is not provided, then there will be a problem. So what is the problem? Emotional state. Emotion. Emotion is a problem. He is an emotional fool, maybe. Okay. Not controlled, not matured person. Emotional state. Emotionally wise people will not react immediately. Somebody says, Mr. Simon, you are a fool. I'll laugh it off. I'll just laugh it off. Because no one knows better than me whether I'm a fool or not. Then why should I be bothered when somebody tells me a fool? That is, his mouth is bad. So why should I fight with that fellow? If I fight with that fellow, I am a real fool. Those people who fight are emotionally immature people. Yeah. That's why they fight. There is no emotional stability. This is mental. This is mental state. Emotional is related to mental, mind. First one is mind related, means brain. Emotional, mental, these words you have to hear. These are synonyms for this word. So emotions is a problem. Maybe she acts wildly. Maybe she cries. Maybe she worries, upsets, tension, hypertension, blood pressure. So emotional state. So her mind is a problem. Her mind is a problem. Okay. The next one. She will be transferred to a more specialized unit. That means, she will be transferred to a more specialized unit. Why? Because this unit is not specialized. The unit is a problem here. The treatment is a problem here. In this unit, the treatment is not proper. So she will go to a more specialized unit. So attention is not proper here. The unit is not specialized. The unit is not specialized. More specialized, it's normal specialized, more specialized unit she has to go. That means this unit is not sufficient for observing her or treating her or managing her. So she is going to a highly specialized unit. So the problem is not the patient, the problem is the unit here. Here the problem is mind of the patient. And here the problem is the unit where the patient is, external. This is internal mind. This is external surroundings. So where she is a problem. She is not in the right place. Here the mind is not right. The mind is not right. Her mental state is not right. Here the unit where she is not right. Okay. A social worker will come to see what help she needs. She needs some help. So here the requirement is a problem. She requires something. She requires something. She requires something. Okay. She requires something. And that she is not getting. So a social worker will come to see what help she needs. She'll come and she'll discuss with her and she'll provide all the needs. Maybe to give her a shower, or maybe to make her walk, okay, or maybe to feed her. What sort of activities of daily living, what help, what support, what aid she requires. So requirement, okay, her requirements are problem. Her requirements are not met. For that reason, the social worker will come and see that all the requirements are fulfilled. Fulfilling the requirements she needs. Fulfilling the requirements. So this is something physical. First one is emotional, mental. Second one is external, hospital. Third one is physical, activities of daily living. Okay. Make her sit, make her stand, make her walk, make her bath, change her dress. Okay, whatever it is. So, first one is mental. So, mental condition is a problem. They are trying to solve her mental condition by observing her care. Second thing is the unit is a problem because in this unit she is not getting proper, she is not managed properly because there are no experienced staff or there is no experienced equipment or there is no whatever. Okay. So that's why she has to go to a more specialized unit. So unit is a problem. This unit is not specialized. So that's why the problem is solved by plan is solution. Solved by changing her to the specialized unit. Third one. Okay. Third one is her requirements. She requires feeding. She requires bathing. She requires changing dress. She requires ambulation. She requires sitting for some time and sleeping for some time. So who is going to adjust all these things, support all these things, give aid for all these things? So plan is a solution for the problem. See, plan is the word here. Everywhere new words will come. New words will come everywhere. So now the problem is related to plan. The plan for emotional imbalance. That means there is a problem. So for that one, there is a plan to solve this problem. Plan is a solution for a problem. Indirectly, it is telling that it's a problem. There is a problem. To solve that one, there is a plan. Don't you see the word problem there? Question is a problem. Problem is some difficulty. So there is a solution to solve that difficulty. So that solution is a plan. So plan is related to problem. So there is a problem. And here the problem is emotional. Here the problem is external. And here the problem is physical. Emotional, external, and physical. So simple as that one. Focus on these three words now. If you focus on these three words, definitely you can understand. Planning for solving a problem. Problem is there. Question means a problem. Nobody will be interested to attend. Many people will be leaving, I know that. But we are least bothered. So 8 students are there now. Fine, no problem. Those who are regular, those who are serious. Today, there are 8 students. Tomorrow, there may be 10. Okay. Right. So let me see who are the regular students. Desi, Meera, Mini, Sunny, Jennifer, Ushani, Vincia. And that's me. 2 are mine. So only 6 students are there. That's fine. Yeah. So this is how you'll identify the problem. If you can identify the problem, you listen only to those words. That's enough for you. Why do you want to focus on everything? There is no need. Print a screen. This is the third question. Okay. Right. Next one, fourth question. Yeah. Fourth question. Yes. So let us see the fourth question now. Okay. Now here. Okay. You hear part of an antenatal consultation. Antenatal. Prenatal, postnatal. Or antenatal, postnatal. Antenatal, neonatal, postnatal. Antenatal, neonatal, postnatal. You have to know all this. Antenatal post consultation, the GP. Okay. Now, you hear part of an antenatal consultation at a GP practice. So, antenatal, going to be mother, would be mother. What does the patient? Patient is a mother, pregnant woman. So, shortly she is going to be give birth. Antenatal means she is going to give birth in the near future. Right. So, what does the patient want to know about? She doesn't know something. Ignorance is a problem. No. She wants to know. She wants to know about what? She wants to know about something. That means she does not have knowledge about something. So that's why it is a problem. Until she knows, she cannot rest in peace. So she wants a solution for that one. What is the solution? Knowledge. She is ignorant. She does not know. She is not wise about that particular topic. So that's why it's a problem for her. If she does not know, then she wants to know. She wants to solve it. So she has to get knowledge regarding that one. So getting knowledge is the solution, because lacking knowledge is the problem. No is the word here. So question means a problem. What is the problem here? She wants to know. That means she does not know. That means she is ignorant. Ignorance is a problem. Lack of knowledge is a problem. She wants to know because she does not know. That means she has lack of knowledge. She is lacking knowledge. And the solution is gaining knowledge. So problem is lacking knowledge. Solution is gaining knowledge. So she wants to know about something. About what? About home birth. She does not know how it will be. Okay? To give birth at home itself rather than coming to the hospital. So she does not know anything about that one. What will happen, how it will happen. She wants to know, because she does not have an experience about this one. First time she is going to give birth. So she wants advice regarding, suppose if in time I cannot come here, or if I am in a position not able to come here, then what about home? Why don't I stay there only? So what are the possibilities of giving birth at home? So home birth. She wants to gain knowledge regarding home birth. If I give birth at home, what are the possibilities? So give me advice. How can I manage that condition? Because she does not know how to manage that condition if she has to give birth at home. So home birth, she does not have any idea. So she wants to know. The next one, ways of avoiding postnatal depression. Postnatal, prenatal, postnatal, antenatal, postnatal. So postnatal means after. After giving birth, maybe she'll go into depression. Depression. Postnatal depression is a problem here. Depression is a problem. Depression is a problem. Okay. Because of the condition, she may be depressed. Because of the pain, because of the severity, because of the problems. Okay. So, she does not know the ways of avoiding. She does not have the knowledge regarding how to avoid. How to avoid. She does not. First one is she does not have the knowledge of home birth, how to give home birth. Second thing is she does not know how to avoid postnatal depression. Okay. So she may go into depression afterwards because of the situation, because of the pain, and because of the condition. Okay, giving birth is not an ordinary thing. So she may get into depression. So how to avoid that? She doesn't have any idea. Okay. Maybe child is going to be born low birth weight, or maybe any type of depression. Okay. And next one, what painkillers might be available during labor? So during labor, painkillers. Okay. During labor. Okay. Now this is the advisability of a home birth. This is before. This is before. This is before. Before giving birth, she has to know. And this is after giving birth. Postnatal is after. And this is during labor, means at that particular time. This is before, means past. This is postnatal, means future. This is during, means present. So try to understand. This is past, present, and future. Before, now, and after. Before, during, and after. You can see that. Post means after. During means while. The advisability of a home birth before she has to take the measures. Okay. So before, after, and during. So before labor, after labor, and during labor. That is the thing here. Before labor, she has to know about home birth. After labor, she has to know about how to deal with depression. During labor, she should know about what type of it. So what is the problem here? Is it after birth, or before birth, or during birth? What is the knowledge that she wants to know? Okay. What is it that she wants to know? Right? So suggestions regarding home birth. There are some measures. There is some postnatal depression. So she wants to avoid that one. So she does not know the ways how to avoid them. Avoiding depression. Avoiding depression. What are the number 1, 2, 3 types of avoiding depression? Then next one, third one, labor. While giving birth, Okay, there's a lot of pain. There's a lot of pain. She will bleed heavily. Okay, she cannot bear. So in order to manage that, what are the measures? She does not know. What painkillers might be available? Will the painkillers be available or not? Okay, what painkillers will be given? She wants to know whether those painkillers will suffice or not, will reduce the pain or not. Can she manage with the painkillers or not? So painkillers during birth is C. Avoiding depression is B. And advice concerning home birth. Suggestions for home birth is A. Suggestions for home birth you need before. Avoiding depression. Depression comes, then only you can avoid. So that is afterwards. For after is after effect. And during labor is while giving birth. So this is the way how you can analyze. So the problem is ignorance. She does not know. The solution is knowledge. She wants to know. No regarding home birth, or no regarding dealing with depression. Okay. Or while giving birth, painkillers. How to? What painkillers? Okay. So this is the way how you can identify. Yeah. One more wicket is down. So 7. That means 5 students are there. Because the second one is also mine. I'm checking how the Zoom is working. No problem. Those people who want to pay, who paid, they don't attend. It's a Sunday, na? We want to enjoy, sir. We want to enjoy, sir. I'm just checking who is really. Okay. The dangerous dynamite who will explode in the exam hall and score the maximum marks. So fine. And next. Question number 5. So question number 5. What did I do? That's fine. Okay, na? Arrow marks I did not give here. Okay, no problem. Okay. Now, question number 5. You hear a trainee doctor telling his supervisor about a problem. See, again a problem. It's a problem. The cause of the problem. So there is a cause. Problem is the result. Problem is the result. So there is a cause. Something is causing this problem. So a reason is there. Some problem is there. Some mistake is there. Some mistake is there. So because of that, there is a problem. Something went wrong. That is the reason. Cause and effect. Effect is the problem. Effect is the problem. Okay. You made a mistake. You did not see on the ground. You fell into a ditch. So you landed in the hospital. So broke your bones. That is the problem. Breaking bones is a problem. And the cause is carelessness. So what is the cause of this problem particularly? The trainee feels the cause of the problem was something. What is that? Is it the treatment now? Previous treatment? Or the patient's reaction? Or the wrong equipment? So the cause of the problem is So this itself is a problem. Problem, cause of the problem is again a problem. Okay. Right? So that is a cause. So here he is talking about treatment. Previously he took some treatment, and that treatment is coming in between the present treatment because he took that treatment. Okay, sometimes you take some treatment, you cannot take some medication because that medication and this medication contradicts. So here the treatment is the previous treatment is a problem, treatment. And here the patient is a problem. He reacts negatively. He says, no. The patient is a problem. He is negative minded. And then equipment is a problem. Okay. Right? Right? The second one is patient. The first one is doctor, medical professional. Second one is patient. Third one is the instrument. Okay. Other than patient and equipment. So problem, which is the problem? Patient is not responding properly. That's why the problem. Equipment was not good, not suitable, inappropriate. So that's the problem. So which is the problem here? Which is the cause of the problem? Cause of the problem is again a problem. One came in again. Okay. So cause of the problem, cause of the problem. The cause is treatment. The cause is patient. The problem is with the patient. The problem is with the equipment. Okay. Because there is a problem, another problem comes. Cause is a problem, therefore effect is also a problem. Okay. Treatment is the problem. Previously he was treated for something, that is a problem. And now patient is a problem here. Treatment is not a problem. Patient is a problem. He doesn't respond properly. Then third one, equipment is a problem because the equipment is damaged or not suitable or problematic or defective or not correct one. So see one word, everywhere related to problem only, all the questions related to problem only. Only the thing is you should open up your eyes to identify what he's telling. Okay. You have to open your eyes to identify. The procedure was going on. Okay. That time, what is the problem? Right? First one is the doctor or medical professionals. Second one is the person, patient. Third one is the equipment. So that's it. Focus on these things and listen. That's all. You need to close your eyes and you'll get the answer. Close your eyes and you'll get the answer. Right. Next. 30. The last for today. Simon sir is tired. The last for today. Yeah. Okay. You hear a doctor talking to a teenage boy who has a painful wrist. Pain is the problem. Okay. Pain is a problem. He has a painful wrist. The doctor wants to establish whether. Okay. So what is the cause of this pain? Pain is the result. He wants to establish the cause. He wants to establish the cause. He wants to find out. He wants to diagnose the problem. which is leading to painful wrist. Why is this wrist painful? Painful wrist pain is a problem. So it is a problem because of some other problem. What was the problem? A fracture may be misaligned. So here a fracture is a problem. Here always nouns are important. Fracture is a problem. Fracture is a problem. Okay. Fracture is a problem. Okay. The swelling may be due to a sprain. A sprain is a problem, not fracture. Sprain is a problem. Sprain is a problem. First one is fracture. Second one is not fracture, it's just a sprain. Huh? It's just a sprain. Okay. Sprains, dislocations, and fractures. Sprain is normal one. Dislocation is a bigger one. And fracture is the biggest one. Big, bigger, biggest. Sprain is the normal one, big problem. Okay. Dislocation is the bigger problem. Fracture is the biggest problem. So first one is talking about fracture. So fracture was the reason, that's why the pain is there. Okay. And the swelling may be due to a sprain. Sprain is the problem, not the fracture. And there may be more than one bone affected. Here the bones, okay. More than one. So more than one bone. So this is also bone, and fracture also is related to bone. But here it is one fracture, and here more than one affected. Here more than one. And second one is 0. A is 1 fracture, B is a 0 fracture, C is 1 plus fracture, maybe 2 or more. A is 1 fracture, B is a 0 fracture, C is 1 plus fracture, maybe 2 or 3 or 4 or 10. First one is A is just 1 fracture. Second one is not at all a fracture, it's just a sprain. That means no fracture, 0 fracture. Third one is more than 1 fracture, 1 or no or more than 1. Singular or none or plural. Try to understand what he's asking there. Is it 1 fracture or is it 0 fracture? Not a fracture at all, 0 fracture. Okay. Or more than 1 means plural. This is plural. This is singular. This is none. And this is plural. Plural form. You may be a doctor, you may be a physiotherapist, you may be a nurse, whosoever you are. You're not an expert in English. So you have to learn how to become an expert in English. Master the skills. This is the last question of today, for today. And now, yeah, painful wrist. He wants to establish the reason. Reason is again a problem. What is the problem? Fracture, okay, or sprain, or bone. Is it single fracture, or 0 fracture, or more than 1 fracture? Plural. Singular, this is singular. Singular fracture. Multiple fracture. No fracture. So simple as that. What more should I tell you? The problem is a fracture. Whether it is a fracture, single fracture, or not a fracture at all, or multiple fractures. Single, multiple, or no fracture. Fracture is the problem here. Okay, fracture is the problem. That's it. So I'm going to take some students for Onam. The batch starts from 8th, directly on Onam day. If anybody is interested, contact me today. Fine, because I'll be showering some blessings. Because I am currently in Kerala. Okay, and I'm going to celebrate Onam with you people. Okay, so if there are any Keralites, then you can contact me. I'll shower some blessings. Yeah, because I'm going to start a new batch on the 8th. Because 10th old batch is going. There are some students going on the 10th for exam. So I'm going to fill those vacancies. Okay. So I cannot take admissions now, but you can join for the 8th batch. Okay. Onam batch, and you can attend the classes straight away. Those who join today, those who are live on YouTube or on Zoom, they can contact me today before tomorrow 12 noon. Okay. Then I'll give you some special provisions. So, all right. Now this is the last question. So this is how establish the reason for painful rest. Negative consequence means negative reason. Negative reason will give negative effect. So both are problems. The reason is a problem. So the result also is a problem. For example, smoking is a problem. So he'll get cancer. That's a problem. So try to understand the points here. Okay. Not eating is a problem. So he will get stomach pain. Overeating is a problem. So still he will get stomach pain. Okay. Sleeplessness is a problem. You do not sleep. You watch movies till 2 o'clock, 3 o'clock. Okay. And what happens? Next day will be a problem. You'll be dizzy. So negative problem and result also negative. Negative cause, negative result. Both are problems. So everywhere a problem only. Question is related to problem. That's it. Painful wrist is a problem. So he wants to establish the reason. Reason is also negative. So it's a fracture. Fracture, but the thing is one fracture or no fracture or multiple fractures. One fracture is the answer. We know that fracture is the answer. But is it one fracture or no fracture or multiple fractures? That's it. The number is the point here. Number is the point here. Okay. Listen carefully and you will know. Focus on fracture here. No need to focus on sprain. Okay. If he says not a fracture, that means it is B, sprain. If he says one bone was affected, that means one bone was misaligned, means one fracture was misaligned. One means automatically it is A. Multiple, several, some, various, it means C. Various fractures, several fractures, some fractures, many fractures. So that is C. Okay. So this is how you will get the answer. So I'm giving you just 1 to 2 minutes to give your feedback. So you can give your feedback for what you have learned and how it was. So feedback. Not for me, again, I'm telling you. I don't need your feedback. It is for the other students. If you write something, the other students, they may be encouraged to study. They may get an idea. So if you write something, they will see. For example, if I tell I'm teaching very nicely, it's boasting. I don't do that. So what I'm telling you is you tell them so that they will be motivated to learn. Okay. They'll be motivated to learn the right way. You will be the reason for somebody's enlightenment. Why don't you? Why do you want to deprive the others to miss the chance of learning because of you? Okay. Because of you. If you write one sentence, they may read, oh, So and so person. Who is this? Cecilia has written this one. Okay, Cecilia has written. So maybe something is there here, like that one. That is the sixth question. And once again, for the regular students, tomorrow onwards, there is no for others. It's only for the regular students. Today, I gave an open session. After the session, I gave open session. So some students have come. If anybody is interested, you can contact me on my number. This is my contact number. Okay. Grandmaster class. Right. This is my number. Plus 919877867360. So those who are watching the YouTube, I want the genuine students. I don't want the students who play the fool. No playing the fool with Grandmaster class. You have to work hard and you have to get excellent results. Grandmaster class. Plus 919877867360. Nine 9877867360. This is my number. You can contact me personally on WhatsApp. Admissions open for Onam batch. You can write your comments. I'm giving you 1 minute more, maximum 2 minutes. Submit your answers. Yeah, for this 1 week, this is the fee schedule. Okay, this is the fee schedule for this 1 week before Onam. After Onam, it will be 12,000 per month. This is for monthly basis. And for doctors, it is 20,000 per month. Nurses, it is only 10,000 per month. All the things are doubled for doctors. Writing is 10,000 for doctors. For nurses, it is only 5,000. Speaking is 10,000 for doctors and nurses 5,000 only. Listening is 6,000 for doctors and nurses 3,000. Reading is 3,000 for nurses and 6,000 for doctors. Everything doubled for doctors. And if it is 1 month, 10,000. And if it is 2 months, it is 15,000, and 3 months, 100 days, it is 20,000 for nurses, and doctors it is +5 +5, same for the second and third months. So those who are interested can contact. Yeah. 10, 7, 6, 5, 4, 3, 2, 1. That's the end. So nobody is ready to give even feedback. That's fine, no problem. Good night.